Here are the top stories for today, June 2nd, 2021. Malacañang lauds the inclusion of Sinovac on World Health Organization's emergency use list. Healthcare workers in the public and private hospitals are set to receive their special risk allowance from the government. Cebu's effective COVID-19 protocols may be duplicated nationwide. The Department of Tourism stressed the importance of testing before travel. Good day, I am William Theo. Welcome to the PNA Newsroom. China's Sinovac vaccine is the 8th coronavirus vaccine authorized by the Global Health Organization. The World Health Organization on Tuesday approved the use of the vaccine, saying it meets international standards for safety, efficacy, and manufacturing. In assessing Sinovac's vaccine, the WHO said it included on-site inspections of the production facility. It says Sinovac is an inactivated vaccine and its easy storage requirements make it very manageable and particularly suitable for low-resource settings. Meanwhile, Malacañang lauds the inclusion of Sinovac on World Health Organization's emergency use list. Presidential spokesperson Harry Roque says this shows that Sinovac is highly effective, safe, and efficacious against COVID-19. Malacañang is also positive that the inclusion of Sinovac on the list will boost the confidence level of all the Filipinos on the said jab. The government targets to administer 4 to 5 million COVID-19 vaccines for this month. Testing Czar Secretary Vince Dizon says the aggressive target is due to the arrival of more COVID-19 jabs within the month. Dizon said the country now has 5.2 million administered vaccines since the start of the massive inoculation program. He said that from an average of 11,000 jabs per day, daily vaccine administration reached nearly 200,000 in the 12th and 13th weeks. Last week, a total of 1.1 million COVID-19 jabs were administered nationwide. Dizon said the vaccination rollout will be faster with the help of the private sector. The government is positive that the adult population protection will be achieved by the month of August. This means the entire adult population is already vaccinated by that time. Vaccine Czar Secretary Carlito Galvez Jr. said the scenario is not mere wishful thinking, as they expect the arrival of about 15 to 20 million COVID-19 jabs by August. The 6 vaccine sources are AstraZeneca, Pfizer-BioNTech, Moderna, Sinovac, Gamaleya, and Novavax from the COVAX facility. He said that the government worries about more is vaccine hesitancy, which is at about 49%. The government is gearing up for the vaccination of the A4 and A5 groups between June and July. These are the economic frontliners, government workforce, and the indigent population. Healthcare workers directly in contact with COVID-19 patients will continue to receive their special risk allowance. Under a new administrative order signed by President Rodrigo Duterte, COVID-19 special risk allowance of up to 5,000 pesos will be given per month. The grant of the allowance shall be prorated based on the number of days that a frontline health workers physically report for work in a month. President Duterte signed the order in recognition of the heroic and invaluable contribution of our health workers throughout the country. This is also part of the Bayanihan to Heal as One Act, or Bayanihan 1. The Department of Labor and Employment is pushing for the inclusion of people working from home in the A4 group. Labor Secretary Silvestre Bello III said the measure will benefit around 16,000 workers in Metro Manila who are working from home.
Yung mga work from home workers ay kasama na rin sa A4 kasi hindi naman nangangahulugan na kapag work from home sila ay hindi na sila pumupunta sa kanilang tanggapan. Pumupunta pa rin sila pero most of the time ay nasa bahay sila.
The healthcare utilization rate in the National Capital Region went down by 28% from its peak, from 68% overall to just 40% towards May. Health Secretary Francisco Duque III also cited a drop in health systems capacity, citing ICU bed utilization going down from 88% to 53%. The decrease in the healthcare utilization rate in the NCR can be attributed to the decline in COVID-19 cases as community quarantines were imposed in the region. The government used the quarantine periods to expand the health system's capacity, which resulted in more beds in hospitals and healthcare facilities dedicated to patients with COVID-19. Meanwhile, Region 9 and BARMM have critical risk ICU utilization rates, while other areas are at high risk. As of May 31, the national healthcare utilization rate is at 48%. At the peak of the surge from April 13 to 15, the rate reached 54%. The World Health Organization said a special meeting will be held on November 29 to discuss major reforms and enhance its ability to combat pandemics and health emergencies. On its final day on Monday, the 74th World Health Assembly agreed to strengthen cooperation to create mechanisms for communication, coordination, and articulation of programs and policies on health issues. It will seek to adequately respond to risks and public health emergencies of international concern. Dr. Michael Ryan, Executive Director of the WHO Health Emergencies Program, welcomed the resolution as he called to turn in interconnectedness brought on by the COVID-19 pandemic into a strength. World Health Organization Director General Tedros Ghebreyesus meanwhile called attention on managing trauma and mental health issues related to the pandemic. The resolutions came from the Independent Panel for Pandemic Preparedness and Response, which called on the global community to act more to end the pandemic and adopt reforms to prevent the next crisis. Let's now take a look at COVID-19 figures around the world. Still to come, more Filipinos can now avail of free medical checkups. And drivers who wish to join the service contracting program of the government have until Friday to register. How? We'll find out when the PNA Newsroom returns. The COVID-19 pandemic has greatly changed our lives for the worse. Lives and jobs were lost and economies reached a meltdown. Thanks to the arrival of safe and effective vaccines, we are one step closer to normalcy. It's time to do our part, get vaccinated for our safety and for our recovery.
You are there in that community, go there and have yourself vaccinated by any of the vaccines available. They are all potent, they are all effective.
I would like to appeal to all our kababayans, please get vaccinated against COVID-19 and be the government partner in preventing further spread of the disease. I encourage you to get vaccinated as soon as possible time. These vaccines are safe and they are the key to reopening our society. The need for international solidarity and cooperation cannot be made clearer than this pandemic, because everyone is safe. No one is safe globally until everybody is safe.
Vaccines work. Lawmakers at the House of Representatives passed several measures, including the Bayanihan to Arise as One bill, which will provide additional aid to Filipinos affected by the COVID-19 pandemic. Marita Mawahe has the story.
The House of Representatives on Tuesday approved on final reading the Bayanihan to Arise as One bill, or Bayanihan 3, that will provide more aid to Filipinos amid the COVID-19 pandemic. With 238 affirmative votes, no negative votes, and 1 abstention, the Chamber passed House Bill 9411, which proposes a stimulus package amounting to 401 billion pesos. Under Bayanihan 3, 2 rounds of financial aid worth 1,000 pesos shall be granted to each Filipino. Pandemic-affected households shall receive a one-time cash subsidy worth 5,000 to 10,000 pesos. The bill also offers wage subsidies, assistance to displaced workers, assistance to the agri-fishery sector and cooperatives, medical assistance to indigents, and local government support fund. Other assistance are for national nutrition, cooperatives, basic education, and pension and gratuity fund. House lawmakers also overwhelmingly approved on third and final reading a measure providing for a free annual medical checkup for Filipinos. Under House Bill 9072, or the Free Annual Medical Checkup Act, all Filipino citizens by virtue of their membership in PhilHealth mandated under the Universal Healthcare Law shall be entitled to the applicable benefits under the Philippine Health Insurance Program. Members shall be entitled to a free annual medical checkup that shall include blood sugar and cholesterol tests. Laboratory and diagnostic tests shall be expanded, subject to the availability of PhilHealth funds. Meanwhile, all internet service providers may soon be required to implement a rollover data allocation system for their subscribers, wherein unused data is carried over to the next month. This as the lower chamber passed House Bill 9057, or the Rollover Internet Act, which seeks to mandate and institutionalize the rollover data allocation scheme. The bill guarantees that end users of internet services will get the most from and enjoy to the fullest the data allocation that they pay for. Subscribers with unlimited data packages are exempted from the act. For the PNA Newsroom, I'm Marita Muaje.
The Land Transportation Franchising and Regulatory Board, or LTFRB, is urging traditional public utility jeepney drivers to join its Service Contracting Program, or SCP. The LTFRB opened a general registration and orientation activity beginning Wednesday, June 2nd until Friday, June 4 at the Quezon City Memorial Circle basketball covered court. Drivers who wish to join the program must be driving a TPUJ unit plying routes that are already open and qualified for the SCP. Applicants must bring a photocopy of their professional driver's license with 3 specimen signatures, a certification from their operator that they are an authorized driver of the declared TPUJ unit, a photocopy of the operator's valid ID with 3 specimen signatures, a photocopy of the ORCR of the TPUJ unit, a printed copy of the screenshot of the driver's GCash account, and finally, a photocopy of their Certificate of Public Convenience. Under the SCP, PUB drivers and operators receive a cash incentive from the LTFRB in return for transportation services. Cagayan de Oro implements measures to curb the rising number of COVID-19 cases, while Iloilo prevents interzonal travel to limit the movement of the residents there. More on these and other news from the provinces from Chris Mundo.
In Cagayan de Oro City, COVID-19 vaccination drives will go unhampered despite being placed under the Modified Enhanced Community Quarantine or MECQ. This as the Northern Mindanao Medical Center has declared Code Red. The region's COVID-19 referral hospital is currently using 50% of its facilities and services for COVID-19 cases. Following the MECQ status in the city, all businesses surrounding the iconic landmark St. Augustine Metropolitan Cathedral is closed from June 2 to 15. Mayor Oscar Moreno said the city government is keen on reducing the critical utilization rates of hospitals so that the quarantine classification status, which runs up to June 15, would be lowered. In Iloilo, non-essential travels within and outside the province are prohibited starting Friday, June 4 until June 18. Governor Arthur Defensor Jr. issued Executive Order No. 175 imposing strict municipal quarantine as confirmed cases in one town trace the source from another municipality. As such, only authorized persons outside their residences or APORs will be allowed to travel within the province. Returning residents and overseas Filipino workers are also allowed to enter but are still subject to the RT-PCR test. In Albay, Daraga Mayor Victor Perete ordered all their barangay chairpersons to strictly implement the health protocols. This after the municipality has reverted to General Community Quarantine or GCQ. Those who are caught not wearing their face mask in public places will be penalized for up to 2,500 pesos or imprisonment of not more than 30 days. Curfew is imposed from 10 p.m. to 4 a.m. And in Lawag City, dine-in services are prohibited to control local transmission. All food establishments, however, can still operate an outdoor dining area at 50% maximum venue capacity as well as delivery and takeout services. The city intensifies its implementations of the minimum health protocols as it orders all barangay officials, personnel of the Philippine National Police, Bureau of Fire Protection, health personnel to go after violators. For the PNA Newsroom, I'm Chris Crismundo.
Up next, Cebu's effective COVID-19 protocols may be duplicated nationwide. And the Department of Tourism stressed the importance of testing before travel. The PNA Newsroom returns after these reminders. You're still watching the PNA Newsroom. The Philippine Statistics Authority, or PSA, is opening a mall-based registration for the Philippine Identification System, or PhilSys National ID. The PSA partnered with Robinsons Corporation, allowing for the second phase PhilSys registration process in select Robinsons Mall branches nationwide. This partnership would be part of the Robinsons Lingkod Pinoy Center program, the Giant Mall's public service flagship. PSA Undersecretary Dennis Mapa said the newly forged partnership will help the government expand the registration of more Filipinos to PhilSys. The government targets to register around 50 to 70 million Filipinos within the year. The registration centers would be open to the public from Mondays to Sundays. Registration for PhilSys is free of charge. Meanwhile, the PSA advises those registering for the Philippine Identification or PhilID card to use the Chrome browser for online registrations. If the website is constantly inaccessible, the user may try to clear the cache of the browser by going to the settings menu and choosing the Clear Browsing Data or Clear Cache option. The PSA assured, though, that upgrades are ongoing to make registration easier. More information may be sourced through the official Facebook page, email, or by calling Hotline 1388. Close to 18,000 communist rebels and supporters have returned to the government's fold from July 2016 to May 2021. Navy Captain Ferdinand Buscato, Executive Director of Task Force Balik Loob, said benefit claims of rebel returnees are checked meticulously before they are admitted into the government's integration program. Validated surrenderers will be enrolled to halfway houses wherein they will undergo various programs such as de-radicalization, livelihood, and skills training. After that, they would be awarded with assistance packages created depending on what a former rebel wishes to achieve upon reintegration into mainstream society. Task Force Balik Loob supervises the government's reintegration efforts for members of the CPP, NPA, NDF, and their immediate family members. Cebu will comply with national policies while it awaits the National Interagency Task Force's study on the province's COVID-19 situation. This as President Rodrigo Duterte tasked Health Secretary Francisco Duque III to look into the possibility of applying the province's COVID-19 response measures nationwide. Governor Gwen Garcia said President Duterte instructed Secretary Duque to find out why Cebu's COVID-19 protocols, particularly its swab upon arrival policy for OFWs and returning overseas Filipinos, are working. She reiterated that Cebu's unique quarantine and testing protocols aim to minimize their financial and emotional burden. Garcia also thanked Senator Christopher Lawrence Bongo, who was also in the meeting, for recognizing Cebu's success in managing the COVID-19 crisis. She said Go has seen how Cebu has been able to manage its pandemic and open up its economy since last year. Policies in the tourism sector are in place to assure the safety of the communities where tourist attractions are located. Tourism Secretary Bernadette Romulo Puyat said tourists always undergo swab tests before traveling. This is aside from the continuous reminder to observe the minimum public health standards. Tourists are also required to pre-register before their travel to a destination which was authorized by the Interagency Task Force to receive visitors. Puyat encouraged local government units to consider opening their areas to tourists. Puyat assured that the DOT is willing to provide technical assistance and support to LGUs who intend to reopen their areas for tourism. Here's another look at today's biggest stories. Malacañang lauds the inclusion of Sinovac on World Health Organization's emergency use list. Healthcare workers in the public and private hospitals are set to receive their special risk allowance from the government. Cebu's effective COVID-19 protocols may be duplicated nationwide. The Department of Tourism stressed the importance of testing before travel. Thank you for watching another episode of the PNA Newsroom. To check more news content, visit our webpage or head onto the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also watch us on television on PTV4 and IBC13. And that's your daily dose of the biggest stories that you need to know from the PNA Newsroom. We tell stories that inspire change. I am William Theo. Good day. Stay safe, everyone.